flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Has the agenda been posted in compliance with NRS?
Yes. Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 3rd day of January 2025 between the hours of 2 p.m. and 5 p.m. at all the locations listed on the agenda.
Would the clerk take roll, please?
Chair Ken Tedford,
Here.
County Manager Jim Barbie,
Present.
Justin Heath,
Here.
Bob Erickson, Denise Ferguson,
Here.
Don Witten, Jeb Rowley,
Here.
Rich McKay, Brandon Chaddick,
Here.
Tony Roos, Connie Gottschalk,
Here. That's it.
Is there anybody on the phone or whatever, video or?
Jeb and Justin Heath are on the phone.
Okay. So we have a quorum. We can proceed. Item 5 is for public comment. There's another one, item 9. Public comment is general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment?
Mr. Chairman, members of the board, if I may, for the record, Darren Winkleman, I would just like to introduce two of our newest board members, Connie Gottschalk and Tony Roos. Tony is with Mineral County and Connie is with Pershing County. So welcome and thank you for taking on this role.
We both welcome you here today. Thank you. Appreciate you being with us. We'll move to item 6A then, consideration and possible action concerning approval of the minutes held on December 12th, 2024. I'll entertain a motion.
Mr. Chairman, Jim Barbie, for the record, I would move to approve the minutes from the meeting held on December 12th, 2024.
Do we have a second?
For the record, this is Denise Ferguson. I'll second.
We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and the minutes of December 12th have been approved. We'll go to item 7A. Agenda item, consideration and possible action concerning election and appointment of the chair and vice chair of the Central Nevada Health District Board of Health. Darren?
Mr. Chairman, members of the board, for the record, Darren Winkleman, the first meeting of the year, we have to elect a vice chair and chair and vice chair. The vice chair, or the chairperson is basically presides over all of the meetings, maintains the order, calls special meetings as needed, generally represents the board. The vice chair will take those roles on if needed. And so we just need to, you as a board need to elect those two positions.
Okay, entertain a motion for chair of the board.
Mr. Chairman, Jim Barbie, for the record, I would nominate Mayor Ken Tedford.
Do we have any more nominations for chair?
I would agree, as long as you're willing to do it again.
I'll do it again. Wait at least one more time here, I guess. No more nominations, then we'll call for a vote of the board for chairman, Mayor Ken Tedford.
Aye, in favor.
All in favor, say aye.
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 None opposed? A motion carried, then Mayor Ken Tedford will be chairman of the board. The vice chairman, do we have a motion for someone to serve as vice chairman?
Mr. Chairman, members of the board, for the record, Darren Winkleman, your current vice chair is Dr. Justin Heath, so just a FYI.
For the record, Jim Barbie, I'm happy to throw Dr. Heath under the bus and would nominate Dr. Heath.
We have a motion to nominate Dr. Heath as vice chairman of the board. Are there any more nominations? Being none, I'll close the nominations and go ask for a second for Justin Heath as Vice Chairman of the Board.
For the record, Denise Ferguson, I'll second that motion.
We have a motion from Denise to second Justin Heath as Vice Chairman of the Board. All in favor?
Aye.
None opposed? Motion carries, and Dr. Heath will become Vice Chairman of the Board, or will remain, I guess I should better put it that way. So we have a Chairman and we have a Vice Chairman. We'll move to item 7B, consideration and possible action concerning approval of the notice of subaward between the Public Health Infrastructure and Improvement Office of the Administration of Central Nevada Health District to support an improvement of data management in the amount of $94,477 from 12/30/24 through 11/30/25. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this particular subaward is designed to provide IT infrastructure for our new building. We'll, a portion, all of this plus some other funding we have will go for cabling, servers, switches, all the infrastructure we need to kind of put that building together so we have a robust data management system. And so this grant has kind of been in the works for quite some time. We finally got it narrowed down. It is a tight kind of window we're going to be working with in terms of working with the county to, finalize the building plans and get all that in place, but that's what this particular funding will go for.
Okay, are there any questions of Darren concerning this subaward? Being none, I'll entertain a motion.
I don't have a question. No, I have a secondary question, but it's probably not on the subaward, sorry. For the record, Denise Ferguson, did you have a proposed timeline at all? Because you said you're possibly concerned about the window, but it goes to November of 2025, so we have most of this year, but is it your thought that it's going to take most of the year to get that process done into your building? Okay.
I believe we can. Some of this, in this particular funding, for the record, Darren Winkleman, this particular funding, some of that is hardware driven, and so we'll be able to purchase it, really, if we wanted to purchase that today, we could. We're trying to get a couple bids in to determine what that's going to look like. We met with a company today that's going to provide a bid, so kind of waiting on that, but I think we can make it work between this, again, this funding and another
Okay.
pot of money for us, but, yeah.
Thank you.
You know how construction goes, but,
No, I know.
yeah.
Yes.
Okay, still entertaining a motion.
Mr. Chairman, Jim Barbie for the record. I would move to approve the notice of subaward between the Public Health Infrastructure and Improvement Office of the Administration and Central Nevada Health District to support in the improvement of data management in the amount of $94,447 from 12/30/2024 through 11/30/2025.
Do we have a second?
Brandon Shattuck, for the record, I'll second the motion.
We have a motion, a second. All in favor?
Aye.
None opposed? Motion carries, and that subaward has been approved. We'll go to item 7C, consideration and possible action concerning an approval of a notice of a subaward between the Office of HIV and the Central Nevada Health District to support HIV prevention services in Central Nevada in the amount of $20,002 from 8/1/24 through 5/31/25. Darren Winkleman.
Mr. Chairman, members of the board, for the record, Darren Winkleman, this is a new grant that was, given to us over the last couple months. We've been working on trying to figure out what that's going to look like through the Office of HIV for the state. This will allow us to just enhance some of the services that we're currently doing, interpret, disseminate, look at HIV data, start to look at trends, what's happening. Again, just to give us a little bit more money. Some of the things we do already in the testing on HIV, this just helps us to move that up a notch a little bit. So funding that the state actually came to us for and recognized that we needed it, and we were able to at least give us a little bit of their money, so.
Okay, are there any questions of Darren on this sub-award? Being none, I'd entertain a motion.
For the record, this is Denise Ferguson. I'll make a motion to approve the notice of subaward between Office of HIV and Central Nevada Health District to support HIV prevention services in Central Nevada in the amount of $20,002 from August 1st of 2024 through May 31st of 2025.
Do we have a second to that motion?
Second.
We have a second. All in favor?
Aye.
None opposed? That motion is carried and that sub-award has been approved. We'll go to item 8A, the fiscal report for 2024. Darren.
Mr. Chairman, members of the board, for the record, Darren Winkleman, just giving you an update on current FY25 budget numbers and where we're at halfway through the year. I believe you have a spreadsheet in your packet along with a pie chart. And so I'd like to focus in on kind of in the spreadsheet itself on that left side, projected expenditures. You look at the bottom of it, we expect, we had a expenditure budget of about $2.8 million this go-around. Right now, as of when this report was developed, we had the data up through November, I believe it was. We're at about, expenditure-wise, of about $750,000. You can see that we're in really, really great shape. Part of that is because we do have some vacancies in personnel. We have a vacant person out of Eureka and one of our people in Pershing County. So obviously that helps. We've been able to absorb those duties, talked to Jeb up in Eureka County at length about the one position there, and we'll feel we can leave that vacant moving forward until we can find some additional funding without any reduction in service. And I think we can do the same in Pershing County using some of the resources we have here in Fallon. And so overall, we're in good shape. The member funding is coming in. I think we're current up to date except for one. I think we're missing one payment from one of the counties, and so we've reached out to them to see where that's at. Generally not a problem to get that revenue. We're in really much better shape, if you remember this time last year, in terms of our grants and what grants were executed. We have almost all of our grants executed, where last year we were way behind on that one. So we have a couple you'll see on your sheet that actually should be updated. SB 118 is actually executed. There's a couple on there. I think 646 now is executed, but some of the ones that are pending are really new grants for us. That just we haven't been able to get them through the state system yet. You'll see probably a couple more of those in the February meeting. So really, I think ultimately, we are looking good as our budget goes. I would like to point out that we have roughly about $500,000 in our so-called bank account, which is super, because as you know, when we started this endeavor, we were at zero. And so now we're at 500,000. That's not by chance, that's by design. We worked very, very hard over this last year to make sure that we were maximizing every dollar that we could in the grants. Did we maximize 100%? No, but we maximized everywhere we could with the timeframes that we had. And I can't take credit for that. If you look behind me, this team, but Shasta, we call Shasta the fixer. She came in and as you know, we've had some trouble with some of our personnel on the grant and fiscal side, so Shasta came in and stepped up and was able to maximize and get those dollars for us. And so right now, we believe we're going to be sitting with more revenue coming in this year. If you'll see at the bottom right of your spreadsheet, about $315,000. But if you look at what we have expended so far this year, we think that number is going to go way up. And so we'll be able to, again, maximize our revenue coming in, and so that hopefully that our bank account will go up even a little bit more, which is helpful obviously for numerous reasons. But as you know, as district members, you have a contingency fee. We've met that contingency, so we're no longer billing for that contingency this year. I sent those rates out I forgot the date, I'm sorry, sometime maybe this week. And that, in that email to your comptrollers, we did not include that contingency fee. So that's, I think, a win for us as well. So I think overall, we're looking good. We had our budget kickoff with the county yesterday and going into FY '26. And so we'll be developing that budget over the next 3 weeks, and then presenting that budget to you in the February meeting. So we're confident that we're in good shape. We have some positions that are vacant that will most likely leave vacant until we understand a little bit more about what happens in this legislative session. We have a couple options that are happening in the session right now, well, here in a couple weeks, I guess, when it goes in. But so there is some things in the works there that may help us out ultimately in our funding to be a little bit more sustainable and not so much reliant on state grants or the federal grants that we have. So I'm pleased with where we're at. And with that, I'll open it up to if you guys have any questions, or if Shasta probably knows more about this than I do, but I'll do my best to answer those questions.
For the record, Denise Ferguson. I just have a couple questions, too. I think it's great that we've been able to save in staffing. I mean, obviously, that's your biggest expense. Benefit-wise, do you see any increase in some of like the health insurance and some of those things that aren't predictive because you just started? I know PERS is going up August 1st, so did you plan for that for the last quarter or third of the year? And then my secondary question is, at the end of last year, we talked a lot about what you guys did for Burning Man. And maybe next month, could we hear what your plan was to propose an increase in those rates to us so that we know what that's going to be, so that you guys aren't so under in the third quarter?
Mr. Chairman, members of the board, for the record, Darren Winkleman. Denise, yeah, thank you for that. Yes, we had that great news yesterday in the budget kickoff meeting about the PERS, and I think health insurance has gone up a little bit. Preliminary look at our budget right now, we're going to be able to absorb that going into FY '26. And again, we're hopeful that it doesn't look, I shouldn't say this because I don't jinx it, right? But right now, we don't think we're going to dip into any of the reserves going into FY '26. Mindful that our clinical manager here in Fallon has submitted her notice, and so she's going to be leaving in February. And so when we look at this budget, we're going to be looking at that, whether we hire that position, and so that may affect, how we move forward overall budget-wise. Our favorite topic, Burning Man. Yes, Maria has worked on a fee structure, looking at what that may look like for Burning Man. We are putting together some kind of hourly rates and tying that to what that overall fee structure may look like. So that's where we're at right now. We have, I have to look, Maria stepped out of the room, I think. I don't know, she was in contact or is going to be in contact with the representatives from Burning Man to let them know kind of what that's going to look like, so they have a heads up moving forward as well. But yeah, we have been looking at it, so.
Mr. Chairman, Jim Barbie for the record. I just wanted to commend you on keeping some of those positions open to give yourself some room and maybe to address the health component as we move forward in the county budget, which impacts where you guys build your budget. We're predicting a 5% increase in health, but we don't know what that's going to be now. We're currently in negotiations on that, and we've had some other outlier things that I think are going to impact that. I think could impact it in a positive way, but we're working on that number as quickly as we can, both obviously for the benefit of the health district, but also for the benefit of our ability to build our own budget. But we are very cautious in our budget building at the county as we look forward, because we've got new administration. We're not sure where all of that's going to land. We looked at the state's economic forum and their prediction of 7% over the next 2 fiscal years, the early prediction, recognizing that they'll have an updated one in May, and then looking at where we're at in the county with we've had about a 4.25% growth in property tax over the last couple of years, so that's good news. But on the other side, we've been super flat for 2 years in our sales tax, and we've appear to be trending down 3%, headed towards 4% in the current fiscal year on sales tax. So we're trying to be very cautious in how we're building things, and I think that's going to be reflective. But I did want to give you a compliment and a hat tip in doing that, and that's the same things that we're doing at the county. We're gapping positions to maintain some of that personnel payroll, because that's our biggest part of the pie, as everybody looks at the pies in government. So thank you and good job.
Well, excuse me, you need to go along with what Jim's saying. Besides maybe healthcare going up a minimum of 5%, the PERS is going to be 3.5%. So, that can be somewhat automatic, depending on how labor turns out, the discussions with them. But even if property tax goes up somewhat, on the city side, that's only 13% of our budget. So it really doesn't account for much, It's sales tax that drives those budgets. So those are the numbers to watch when they come in, and they tend to lag. They're not current enough. When you're trying to set budgets, you have to project what those are going to be. So when those numbers are sagging, that's a bad thing. And then the other part of our budget that helps is, building fees, and when there's not a lot of building going on, you don't have a lot of fees. A lot of people scream, about property taxes, but it's just not a lot of the budget, and I try to tell them it's incremental of what those increases are to what would help. Those sales tax numbers are what you need to watch. So when you have some latitude in your employee count, that really helps. Because some of these other things, you're not able to move on your budget. Whether it be capital or your equipment or some of the other items, you have travel to four counties. You're not in one county or in one little city, or one county or in 4 counties, so you're gonna have travel. Any other questions for Darren on this fiscal report?
Mr. Chairman, members of the board, for the record, Darren Winkleman, if I may, also in your packet, I think I'm reading this correctly, and Mr. Barbie can correct me if I'm wrong, but we went through our first audit as the Central Nevada Health District, and I believe the way I'm reading this report, we passed with flying colors. There was no audit findings in there, and so we were pleased with that. And so, I would like to thank, county's comptroller, Sherry, in doing that and following that and pinging us with what information she needed. And I hope we gave that to her timely, and it seems like we did. And so, just again, I think it's worth noting that we made it through that first go-around, so.
Yeah, that was good, I guess. Yeah, we should have mentioned that for the record. Okay, we'll go, let's skip public comment and go to staff reports first. Dr. McDonald?
Mr. Chairman, Ted McDonald for the record. Welcome new board members, and this is kind of the part that I try not to go too long on or lecture about things. In your packets, you've had the reports parsed out by the different counties in the Central Nevada Health District regarding what the different departments are doing, what clinical services is doing environmental health services, public health preparedness, epidemiology and surveillance, and I provide a executive summary for this. So I try to hit the highlights and make comments regarding the issues that are more pertinent to for Central Nevada Health District, as opposed to maybe working on national or, in some cases, even some state things that happen outside of our purview. I try to touch bases with a lot of these things, though, that do affect us, and try to highlight some of the things that are happening in the different departments. At this point, in the past, we have had some discussions about some oddities in our reporting for suicides and suicide attempts. And at this point, I found that the state is revising how they report things and how they do things. And within the next 2 months, we should have a report from the executive director of the Office of Suicide Prevention. So there'll be some clarification there. I have found that in discussions recently that some of our numbers may be unusual for Churchill County because we have 4 reporting agencies in Churchill County, and the other counties have 1 reporting agency. So in Churchill County, we have the hospital reports, New Frontier, which is a treatment center, social services, Churchill County Social Services reports, and the VA reports. And I had a meeting this morning at New Frontier, and they do say that they sometimes will report things that have probably already been reported by the hospital. So in the past, some of the numbers that we're getting may look wonky because of this. But the state has recognized this and is putting together a plan to be able to filter this out and provide us with, in the future, with dashboards that make sense and make sense across, our district. So more to look forward there. The flu kind of struck Churchill County late, as it did in most parts of the country. So at the end of December, we started having an increase here in flu. Other counties were not so much affected. I think in Pershing County, there were a few cases, but in Churchill County, we had a surge. The testing so far has been showing that it's an influenza A, which the vaccines that are out work for, and they don't prevent it, but they keep people from going to the hospital. We've had no hospitalizations here for that. I think Pershing County recently reported one person was hospitalized, but there's been no deaths. What some of us may have seen reading is that there's a concern about the avian flu. There's been no reports of avian flu in humans in Churchill County, Pershing County, Mineral, or Eureka County. And the only herd that's been affected by avian flu has been down in Nye County. The reason why the Department of Agriculture has kind of taken this over and requested that the hospital screen for avian flu is that Churchill County and the local areas have 14 of the 18 major dairies in Nevada. And so that puts the dairies at risk and the dairy workers at risk. And not everybody gets screened. When someone comes to the hospital and they have symptoms that may be, and their initial test is consistent with the flu, if they are a dairy worker, if they work with poultry, if they have a severe disease, if they have a conjunctivitis, a swelling of the eye and watering, and that puts them at high risk. The state has requested that we subtype. Subtyping is difficult. The state is offering only 20 tests a week, so they're very specific about it. And it's not just our counties that are doing it, it's the whole state. It takes a whole day to do a test for a subtype. So they really only have enough, and the state has limited resources, so they're only doing 20 a week for the whole state. We have not had any of those tests come back positive, but that's the focus. There has only been one death in the United States recently in Louisiana, and this case was a 65-year-old person with underlying health issues, and was exposed to the virus from his flock of animals. When they did the testing and subtyping, they found that the subtype in the human had changed from what was found in the animals or the birds. And the concern is the mutation that happens when it gets to humans may be a type that is more contagious to humans, and that may eventually become something that is more serious. There have been no human-to-human cases at this point in the United States, and there may only be one in the world that's happened in the past. The whole idea of this process is to cocoon our herds and our flocks to prevent mutations that potentially could be harmful to humans. So when all this is going out, the risk is considered to be very low. So most of this is preventative. It's community health. It's public health at its highest level, where the idea is to protect the population before we have any epidemics, pandemics. So I'll keep it at that. I know that was a little bit long. I apologize, but that's this is always a very touchy subject because, you know, we love our dairy production. We like what they bring to our counties and what they bring to the state of Nevada. And we definitely don't want to create any sort of panic and worry about this, because that's just not in anybody's best interest. So do you have any questions for me?
Any questions for Dr. McDonald? Being none, Darren, do you have anything to add? Okay, we'll go back to public comment. Item 9, is there any public comment? Must be general in nature, not relative to anything on the agenda today. Being no public comment, we'll go to item 11, which is adjournment. So we stand adjourned. Thank you all for attending today. We appreciate your service.